Welcome everybody, good afternoon. We're having a briefing. We said recently and over a period of time that we're only going to have briefings if we've got something to say. And we've got something to say today, but it's a constructive message, but we're asking people to act in a particular way. And we're strongly recommending certain measures. As I say, I emphasise the phrase, it's a strong recommendation rather than anything mandatory. But we know that COVID figures have increased in the bailiwick over the last 7 to 10 days. And today, therefore, we want to discuss the trends that we're seeing. We're coming towards the end of October. We had a storm last night, a tree down in York Avenue. I apologise, it was one of my trees, but hopefully it's cleared now. And so we've got all of November, December, and then January, February, March of next year, which are months where the weather isn't as good as it has been in the past few months. Now, I'm going to speak about a couple of recommendations we're making briefly first. Then I'll ask Dr. Brink to discuss the trends we're seeing and why this new guidance is being issued. I do then have a few more updates, which I'll deal with after Dr. Brink has spoken. The first thing to say is sadly, and it is very sadly, as you may have seen yesterday, we reported the death of an individual with COVID-19. Of course, and I emphasise that word again, that's very sad, and our thoughts are with the person's loved ones, and our sympathies go out to them. Now, what are the CCA recommending today? Well, firstly, we're asking islanders to take up the free lateral flow packs that we began providing last week. Now, of course, the Crown Pier tent has been moved by an act of nature last night, so from today, you'll be able to pick up your lateral flow packs from the Guernsey Information Centre at the North Plantation. They'll stay there until at least a week on Saturday. Now, if you're attending the vaccination centre for a vaccination, you can collect a pack there. If you cannot attend in person, then we'll arrange for delivery. The exact details of when, how and where that you'll be able to get them are all online on our COVID website. What really matters is when we use them. We don't want them to be a burden to people, but we want people, as I'm sure they will in the bailiwick, to act responsibly. We want all islanders of secondary age or older to be using these regularly, but as I say, not excessively. So we recommend people use them. Firstly, they regularly test themselves twice a week, every week, to check if they've got the virus. Secondly, before attending an event or meeting in a crowded or poorly ventilated place, or somewhere where social distancing is either very difficult or not possible. Thirdly, if they're asked to do so by public health, e.g. if the contact tracing team have identified them as a contact of a case. And fourthly, before visiting a vulnerable person, for example, living in a care or residential home. Now, this is an excellent and easy to use tool to help identify positive cases before they can spread. A lateral flow test is, nothing's perfect, but it is very representative and very helpful. But this is not, and I emphasise that, an alternative to staying at home and reporting your symptoms to the clinical helpline if you feel unwell. If you feel unwell, do that. Stay at home, even if you're not sure and you think, oh, I don't want to bother anybody. You're not bothering anybody, you're being responsible. Secondly, we are also strongly, and again I emphasise the adverb, recommending the use of face coverings in specific types of settings. They are where physical distancing is not possible, where there is poor ventilation, where there are close crowds or individuals need to work in very close proximity with colleagues or customers. And although it's not mandatory, it is a recommendation. I ask people from now to follow that. Now, we're not trying to be prescriptive and set out each and every single type of situation where the face covering should be worn. Use your common sense, but my recommendation is, if you're not sure, wear a face mask. We've got to adapt to living with COVID, and what we're trying to do is balance our community with good guidance, but also asking people to take that guidance and make their own decisions, seek to protect themselves, but also the people that they're going to come into contact with. Now, some healthcare settings may be among those that will want visitors to wear a mask, so please check with a healthcare provider before attending. Businesses that feel appropriate for them to ask staff and or customers to wear coverings should do so. That's their right. And customers are urged to respect those requests whenever they might be made. Now, similarly, for some individuals, we fully accept that a face covering is not possible. They can't wear one. So we will ensure that sunflower lanyards are made available, and I'd ask people to respect people who can't wear a face covering in any setting. Don't belabour them, don't be rude to them. They're not wearing a face mask because they can't. Masks are a regular part of life in so much of the world around us, but I know they feel strange. But for example, I was talking to somebody just a day or two ago who visited London recently. 80 to 90% of people on the tube wear face masks. He wishes that the other 10 to 20% also wear face masks because you're in a very close proximity. Now, they will undoubtedly reduce the number of transmissions, especially, as I say, as we go into winter and we're all going to spend more time indoors. Our vaccination rates are truly excellent. They're world leading and they offer a lot of protection. But it's about probabilities. There are still a small number of people who become very ill, and if cases do rise significantly, we'll see more of those and they will need hospital care. That could be us, it could be our friends, it could be people we care about. Thus, this guidance is for all of us to protect each other. So over to Dr. Brink to talk through the detail of what we're seeing in terms of cases, which prompted us to make these recommendations.
Thank you very much, Deputy Fairbrash. So first of all, to give you an update of today's cases. So we saw 34 new cases yesterday. So that's the highest number of cases we've seen since the second wave. So really important that we focus on that. And we now currently have a total of 233 active cases. So again, what we're wanting to do is to act proactively and in a calm and measured way, looking at what evidence we have and what the appropriate mitigations are to prevent further transmission. And if I can remind you of our strategic aims, the strategic aims in the first part of the pandemic were always suppression. But moving on the 1st of July, we moved from suppression into containment. We knew when we opened the borders, allowed freer travel, we would see an increase in number of cases. And we always said we'd respond appropriately if the cases reached a certain level. And we call those level our triggers. And I'll talk about that in a little more detail in a moment. But I want to, before I go on, extend my condolences to the family and friends of the person who sadly died with COVID yesterday. And I think it's important that we focus and think about people during these difficult times for the family and friends. But if we go on and have a look at where we are in our trajectory. So the first wave that you see here is wave 1 that happened in March 2020. The number of cases you see there, as I've said before, are underrepresented because we didn't have our very significant diagnostic capacity that we now have. This is wave 2, happened in January, February 2021, and that was caused by the Alpha variant of concern. And that caused us to go into our second lockdown, and you can see it came very rapidly under control. What we see in the latter part of this graph is you'll see the gradual increase of cases since the wider opening, the relaxing of border restrictions from the 1st of July. That was predicted, it was expected. But what you see in the very last part of this graph is the rapid increase that we've seen over the last 5 to 6 days. Now, this is what we're responding to. And we've always said that we'll respond to local data and we'll respond appropriately to the information that we get. So what I've done here is also looked at the cases by attribution. This is something I look at a daily basis. And the reason why I look at this, it gives me an understanding as to what our risk profile is. Now, if you have a look at this graph indicated in blue, you'll see in the first part, so towards the middle, towards the second quarter and into the third quarter of this year, most of the cases were travel associated. That's indicated in the blue line. But what you've seen in recent times is a decrease in the number of travel associated cases. Now, understanding where our cases come from is absolutely essential because it allows us to put the appropriate mitigations in place. Now, what you see here in orange is symptomatic people. So these are symptomatic people coming forward for testing because they have symptoms that could be COVID-19. And what you see in the first part of this graph is you can see very few symptomatic people coming forward for testing. But in recent times, you've seen that steep increase in the number of symptomatic people testing positive for the virus that causes COVID-19. Now, the green indicates our contact tracing, and what you see here is the number of contacts that are detected through the contact tracing process. So that gives you an idea of the risk, and it gives you an idea of why we are focusing the mitigations that we're putting in place internally rather than on border policies. It's of paramount importance that we look at the data and put in the appropriate measures that match the data that we're seeing. So the other piece of work that we've done recently is we've looked at the incidence of infection in neighbouring jurisdictions. And again, this is important because it tells us a story. And I'm going to start off with ourselves, and you can see here, this is wave 2 indicated in blue. And what you see after wave 2, we had very, very few infections, few travel-associated infections. From the 1st of July, you see the gradual increase in the number of cases. Now, obviously, this graph is to scale, so you can't see the increase as clearly as you can on graphs on a different scale. Now, if we compare ourselves to neighbouring jurisdictions, and we do this for learning and to understand what's going on around us rather than for any other reason. But if you start off by looking at the Isle of Man had a large peak there, you can see, which was larger than our January peak, so just after us. They then became, they went into, they restricted, put some NPRs in, their number of infections decreased, and they've had subsequently a very large peak, and they appear to be increasing again here. If you look at the situation in Jersey, Jersey came off a peak in December time and really had good control, and then went to a very large peak round about July time, and have come under control nicely. And in fact, their incidence per 100,000 is slightly lower than ours now. So it's again looking at these trends and understanding what's happening in the neighbouring jurisdictions. Now, if you look at the UK, which is indicated in grey, is what you can see, the numbers came down, and they've been gradually going up, and you can see the increase in the UK numbers there. Now, I've also included figures from France because I think those are interesting. So France is indicated here in orange, and you can see how their cases went up and then came down and really have come down very nicely, and they actually, their 7-day or their 14-day prevalence or incidence is now very low. So that gives us an understanding of what's happening in our neighbouring jurisdictions. Now, for example, in France, their vaccination levels are very high, but they've also got some NPRs within their community. And indeed, a lot of Western European countries have NPRs within their community. And we've got to look at what's going on in neighbouring jurisdictions to understand what's going on, but also what the risk to us is. So the other thing that I think is important is if we look at our age of cases by age, the number of active cases by age and by vaccination status, because again that gives us an idea of what is going on in our community. So this reflects the active cases that we have today, so the 233 active cases that we have today. And what you see is most of the people who are older are in fact fully vaccinated. We have a smattering of people that are unvaccinated, and of course those cause us most concern because they're more likely to become seriously ill and require hospitalisation. We've had a very large spike in our 10 to 14-year-olds, and you can see that here. That is a group that's only just started being vaccinated, and you can see just a few of them have been vaccinated, and then obviously in the younger age group there. So if you look at the overall and you divide it by 0 to 17-year-olds, of the 233 active cases that we've got, is 105 of those are in 0 to 17-year-olds. So again, looking at that gives us an idea of our risk profile, but also gives us an idea of where we need to intervene and what the appropriate interventions are. And that's important as we design our programs and move forward. So I wanted to pause and talk a bit about something about our current pressures. So we are moving towards the winter months, and what we are going to see now is increased indoor mixing. So indoor mixing, poorly ventilated buildings or poorly ventilated rooms is going to be really important as we move forward. Now, I know today, probably some of you are cold, but we've got the back door open, we've got the windows open. Having this room ventilated and us all spread out is important as we protect each other and look after each other moving towards the colder months. And of course, we're not only worried about COVID, we've got the other seasonal respiratory viruses that we have to worry about as well. So there's influenza. We've already seen activity within our hospital and also within our community from a virus called respiratory syncytial virus, RSV, you'll see it referred to. So all of these viruses are going to become more prevalent over the winter period, and we need to prepare for that. One of my concerns is that we do have people that are symptomatic that are not coming forward promptly for testing and not isolating. And we've had several cases that have been out in the community for 4 or 5 days and sometimes in contact with people that we'd be concerned about and only coming forward late for testing. So once again, I'd really appeal to islanders. I'd like to stress overwhelming majority of people are coming forward promptly for testing, but there are some people that are delaying coming forward. If you do have symptoms, please do self-isolate, get a test, and then we can advise you after that test result. Now, today we've got 3 inpatients within the Princess Elizabeth Hospital. I'm hoping 2 of those will be discharged later today. However, just looking at that peak of infection that I saw, you would expect to see more admissions 8 to 10 days' time. So there's always a lag of about 8 to 10 days between the acute infection and people requiring hospital care. So we just need to be cognizant of that as we move forward and plan. So lateral flow testing is something that we're using a lot of now, and we really are very impressed by the performance of the new generation lateral flow tests. We think they're forming an absolutely essential part of our armory against COVID-19. And that was the logic for making free lateral flow tests available to all islanders. So what we're recommending is that everyone does a lateral flow test twice a week. But what we're saying is that you can't time your lateral flow test to suit you. For example, if you know you're going to an event on Wednesday night, you might choose to do your lateral flow test on Wednesday morning. That's responsible because you know then when you go to that event on Wednesday evening, you've got a negative lateral flow test. So you don't have to do it precisely on the same days each week, but you can look at what your activities are that week and plan your lateral flow testing around that. You may also be asked by public health for some reason to do a lateral flow test, and the contact tracers will ask you to do lateral flow tests if you contacts of cases. Now, this has been extremely successful because we're not asking fully vaccinated contacts of cases or indeed children to isolate. All we're doing is putting a testing program behind it. And that's been really popular with large numbers of the population and has stopped people being put into self-isolation. And I think that forms part of our living responsibly with COVID. Now, I talked about doing your lateral flow test if you're attending a particular event, but you might also be going to visit a vulnerable relative. So doing your lateral flow test on the morning of going to visit the vulnerable relative will also be important. So it's all about us thinking and trying to protect each other. Now, the point that I want to make about lateral flow tests is they are not a substitute for PCR when it comes to diagnosing symptomatic infections. If you do have symptoms, you need to self-isolate, and you need to then phone the clinical helpline and get a PCR test. So lateral flow tests are specifically for the circumstances I outlined and not for the diagnosis in symptomatic people. So I want to move on now to face coverings, and that is a difference for us. And the reason why we're recommending face coverings is that things have changed. The evidence that I've shown you is most of our transmission is coming from within the island. So we've got to then look at what mitigations we have within the island. So lateral flow testing is one part of our protection, but the use of face coverings is another. And this is something we're recommending. We're not mandating it, but we're asking you to think, if you're in a place where you can't physically distance from someone, where there's poor ventilation, if they're very close crowds, is think about using a face covering under those circumstances. It's strongly recommended that you do. If, for example, you're in circumstances that you can't use a face covering, then think of doing a lateral flow test if you're going to attend a crowded event. So it's all about using all of those mitigations and looking at how we can together stay healthy and safe. So some businesses will be asking for it, and we'd ask people to respect people if they ask you to wear a face covering. Of course, a face covering is, we want to be correct in our definition, something that covers your mouth and your nose. And the logic for that is coronavirus or COVID-19 infections are going to originate mostly from people's mouths and noses, and through that aerosol transmission. And, of course, as Deputy Fairbrash said, there are people that can't wear face coverings, so please do respect people with sunflower lanyards. We need to be really respectful of everyone in our society. So our vaccination programme, as Deputy Fairbrash said, is going really well, and this is the latest data. It's actually a couple of days old. Things change so rapidly. But if we look at our whole population, 80% of our population have had at least one dose of vaccine. And if we look at our over 18s, 93% have had at least one dose of vaccine. So really incredibly good uptake levels. If you go to the over 50s, which are the most vulnerable in our society, you're looking at 98% having at least one dose and 97% being double vaccinated. So really good uptake. In the 16 and 17-year-olds, we've got 78% who've had at least one dose of vaccine. We launched the program to vaccinate 12 to 15-year-olds over the last 10 days, and we've now had 405 people have been vaccinated in that group, and we're expecting another 250-odd to come forward this weekend. The booster program is also going ahead, and we've given about 4,700 boosters. So all of the vaccination programs are progressing well, and once again, I need to thank Islanders for the incredible support that we've had from them. And also, I was down at the vaccination centre just yesterday, and it was really encouraging to see how many Islanders came and actually thanked the vaccinators. It made such a difference to have that positive feedback. So it was really a great atmosphere there, and we owe a debt of gratitude not only to Islanders, but also to the team that are running the vaccination centre. So I've talked about the booster program. With a third dose of vaccine for immunosuppressed Islanders, that's a bespoke program, and it'll be designed for each individuals. We've talked about the vaccination of 12 to 15-year-olds, but I just wanted to pause and also talk about the evergreen offer. Is if people have declined vaccination for some reason early on in the program, they're very welcome to come forward and get vaccinated now. Just call the vaccination centre. People are welcome to join the vaccination program at any time. So the offer remains open to all Islanders. And I just wanted to emphasise that. So if we look at the mitigations, I've spoken about some of them individually, but really what we're looking about is not a singular intervention that is going to provide us with the protection we require. So we've spoken about the testing program, so the surveillance testing, the testing with lateral flow testing, the symptomatic testing with a PCR. But I also wanted to mention something about the on-island sequencing. So as I think I've mentioned to you all before, is that we do on-island sequencing. We do a selection of samples every week, and what we have found that all of the samples we've sequenced to date are Delta virus, and in fact what we are seeing is Delta virus A142, which is sometimes known as Delta Plus. Now that virus is being investigated, that lineage is being investigated at the moment by the UK, and we await further information on that. But again, looking at that information is absolutely key because it helps inform our whole risk assessment. Our contact tracing team continues to work a 7-day week and right up to late every evening, and we take the results off and we start contact tracing straight away, so that's working well. I've spoken about the vaccination program. We've now spoken about how we're now going to, as another mitigation, introduce face coverings in crowded spaces, so an important other mitigation. But also, I'd like to encourage everyone to think about ventilation. So we know that the virus that causes COVID-19 is transmitted through two routes. The one is the aerosol, so speaking, generating very small respiratory droplets, and the other is through direct touch. So you cough on your hands, you touch someone else touches it. But that aerosol transmission, particularly for Delta virus, is really important. And what we've seen within households, our experience on Ireland, is if you get one person infected in a household, there's a high probability of the rest of that household becoming infected. And that's really interesting. So what we're saying again is good ventilation. It's just everywhere you go, open the doors, open the windows. I've become a bit of everyone has a laugh when I walk in. The first thing I do is open all the windows. And I think that's really important that we all live the message that good ventilation is important. The hand and respiratory etiquette also important. If people sneeze on their hands, don't wash your hands, all of that type of thing. But that ventilation message really needs to come across very carefully. And then the final thing I just wanted to mention was respect your personal space. So we talked about personal space. So if you're in a queue at the supermarket, don't go and queue right behind the person. Is try and just space out. So wherever you are, just look at the space around you and just try and respect everyone's personal space. So it's that composition or that combination of all of those mitigations, with vaccination being our pivotal protection, but all of those other mitigations being so important as we move into the winter months. And as ever, we've monitored what's happened, and we feel it's appropriate for us to respond proactively when we see a change in circumstances. So thank you. Thank you again,
Dr. Brink, as always, so helpful and so succinct. The point you made about ventilation, remember the air is fresh and it's free, so use it to help us. Ventilation is so important in helping restrict this horrible virus. Also, I'd like to say something. I'm just a politician. I've done it before and I'll do it again, commend the work of people like Dr. Brink, her team, the vaccination team, the contact and trace team. They are so dedicated and so conscientious, and we're so lucky to have them, and they're so under pressure, so please respect them. Now, I also echo Dr. Brink's remarks about vaccination. As she said, if you didn't take up the initial vaccination, it doesn't matter, but you now want to do so though without delay. And if you've been invited for a booster, again, please take that up and do so without delay. I was watching a political programme last night called Peston, and there was a professor from Israel who's in charge of their vaccination process. The booster, since they've been going with their booster, I think perhaps a little longer than us, that has meant a reduction in their numbers. Now, there's no easy answer because there is so many different things, there are so many different things that we could do, but vaccination is important. And so vaccinate, vaccinate and vaccinate. Now, if you're unsure about getting the vaccine, call the vaccine call centre, who can put you in touch with a clinician who will ask any questions you want, or speak to your general practitioner. Now, before we go to questions, I have some further announcements re travel. Now, earlier this week, we announced that we're finalising the work to introduce what's called 2D barcodes, which are sometimes called QR codes, to your digital vaccination certification. Now, subject to final testing overnight, we expect these to be available from tomorrow morning. We'll confirm that, or it will be confirmed first thing in the morning. So if you're travelling or you're going away soon, you'll find in your travel tracker account tomorrow, hopefully, where you currently look at your digital vaccination certificate. Now, more details about the codes, where they are and what they're for, will be on our COVID website tomorrow, all being well. We're delivering this in partnership with NHSX and our UK partners, so we benefit from the same system utilised in the NHS COVID past. And again, my thanks go to everybody involved. It's been a tremendous lot of hard work. Well done to them. Travellers should still take their paper vaccination certificate with them. There's a lot of change happening for travel rules internationally, and that's not something Ireland is intending to travel should be fully, well, that is something that Ireland travel to be aware of. Travel is not like it was in pre-COVID times. It will not be like it was in pre-COVID times for a very long time. Separately, we're also making a change next week to the rules for eligible fully vaccinated passengers arriving from outside the common travel area for countries and territories that are not on the red list. Currently, those arrivals have to do a PCR test on arrival. They are not required to isolate. Now, from Wednesday, that's the 27th of October, they will no longer be asked to do a PCR test. Instead, they'll be required to purchase a pack of 5 lateral flow tests, and they must take those on the first day of arrival and then use the rest over the following days. That aligns with the upcoming change that the UK government is making, and it will also further speed up the process at our ports. For clarity, all those who are arriving and have only been to the common travel area are no longer required to take a test. That change came into effect on the 20th. Of course, everybody is still recommended to test themselves twice a week with lateral flows. We mentioned that earlier, regardless of whether they've travelled or not. Now, I'm anticipating some of the questions that I'm sure there will arise. Why are we not tightening up our border measures, given we're calling for more vigilance and new measures locally? As Dr. Brink's slides, and now infamous and famous, have showed, this reflects where our cases are coming from. Our concern isn't about importing cases, it's about keeping the level of cases and the spread of them within our local community down. That's very important indeed. I know also some people will say, well, we would never have had community seeding if we kept the borders closed. I don't regret opening the borders or keeping them open now and allowing people to travel to see family and friends. I was talking recently to somebody who comes from Melbourne. Melbourne has had complete lockdown for the last 8 months. People are going stir crazy. We don't want our environment to be of that ilk. So I urge people to remember that our border restrictions were brought in only as a temporary and not a permanent measure, and they were looked at and regarded for the fact that we had to protect ourselves until we had another remedy. That remedy is vaccine. To keep our borders restricted, even after achieving very high rates of vaccination, is effectively saying we'll keep them closed forever. That's not the way we can live in a sociable and democratic society. And it isn't about putting money before health or the economy. It really isn't. It's about recognising that we now need to adapt to a long-term way, and it will be a long-term way, of living with COVID and still being part of the wider world. Anyway, enough from me. Questions from the media, please. Yes.
Hello, it's Catherine Levy, ITV News. I just wondered if you knew how many cases stem from the Herne Darts Open last weekend, how many of the active cases at the moment, because I understand that was a bit of a spreader event.
I don't have the exact number, but yes, we saw a significant number of cases from there. I mean, we can certainly look at precise numbers, but I don't have that number offhand. But yes, it was a event where we saw cases occurring.
Yeah, it's more than the 3 that was referred to in one of the media.
Rebecca Brady, Island FM. We've had a question from one of our listeners who wants to know what are the chances of another lockdown if the cases continue to rise?
The answer is you can never say never, but very unlikely. Very, very unlikely. This is recommendations, and Dr. Brink has talked about the figures that are coming through in the vaccination process and the booster vaccination process. I am no expert. She very eminently is. But I can see that we'll have a continued booster programme because vaccination has only got a certain life and it needs to be rekindled. But Dr. Brink will tell us about that. She knows far more about it.
I would say another lockdown is unlikely, but we can never say never. The type of circumstances that would trigger another lockdown if you had a new variant that was vaccine evading. So that would be one of the things that I'd be concerned about, because essentially we'd be back to where we began. But at the moment, all of the variants are showing vaccine sensitivity. We're doing well in our vaccination program. The idea is to contain the virus. So while we're bringing in these extra measures, is we just want to flatten that curve. So in the beginning, when we had no vaccination, we were looking at a strategy of suppression, because the population had no protection through vaccination. Now we have a highly vaccinated population. As long as that virus doesn't differ significantly, we would like to get into containment and keep it at a level that is manageable and doesn't threaten to overwhelm our hospital services. So I would say another lockdown is unlikely, but of course not impossible, because I can't see into the future. But there are no plans at the moment for another lockdown.
Thank you very much for that question, because I know that's in the mind of quite a few people. Juliet.
I know in the past you've always said that the hospital capacity is something that's been very much on your mind when it comes to the ideas of restrictions. How is the hospital currently coping, and do you feel the hospital is ready to cope with a possible influx of patients over the winter?
So hospital capacity always remains a concern for us. I mean, as you know, the hospital's full at the moment, and one of the things that we've done and I have to say, I think it's been a really positive output from the pandemic, is that we've thought of ourselves in a singular sense rather than public health, hospital services, community services, and so on. And I speak to Dr. Raby literally on a daily basis. And so all of these mitigation plans have included the protection of the hospital. So, for example, one of our triggers is an increase in cases that could impact on the hospital. So we're seeing an increase in cases, and so rather than wait until we've got an overwhelming number of cases, we're responding now. So it's that early proactive response that I think has been a hallmark of our pandemic response.
Okay. Matthew Lynch.
Bailey Express. Do you have any theories as to why the figures have risen so dramatically in such a short period of time?
I think we've seen, if you look at the data, sorry.
No, I would have asked you to ask the question anyway.
So if you look at the breakdown that I've shown you with regard to vaccination status and number of cases, and I'll go back to that slide. So if you look there, you can see the peak number of cases is in the unvaccinated younger population, and obviously you've got mixing of children and so on. So I think it's what we expected. I think we always knew we'd see a surge of cases. I think what we're seeing now is a trajectory which is upward, that we want to slow down to make sure that we don't overwhelm our facilities. During that time, we've had no school closures. Children have carried on going to school unless they've been a case. The contacts have carried on going to school. So I think it simply reflects the fact that we have seeding within the community, and we've got transmission amongst various groups, and particularly amongst unvaccinated children, which there's nothing we can do about that.
John Fernandez from BBC Channel Islands News. Do you think more people will be willing to come forward for symptomatic testing if we could decrease the waiting time further? Because at the moment we're hearing a lot of people calling up to the station saying that they have had to wait quite a long time. And also, would you be able to tell us what the average waiting time is?
I don't know what I'll start to break. We'd like it to be shorter, but the reason is that, again, it's the point I've made. Staff are under tremendous pressure. We're grateful to people. We would ask them to be indulgent. We would ask them to call, and if they can't get through, to recall. Everybody is working so hard. I mean, I really am. I've got such great admiration for the people at every level involved in this. If there were more people available, they would be applied to these various tasks. I don't know if there's anything you want to add, Dr. Breen.
No, I think that answers it. Thank you.
Matthew.
The Crown Pier tent, will you be replacing it or moving it permanently, especially as we come into the winter months? I can expect lots more storms, I suppose.
Yeah, you're right, and it reminded me a bit of Mary Poppins really when it flew away. But thankfully, nobody was hurt. I don't believe that the intent at the moment is to re-establish it. So it's gone a few days early. It'll now stay gone.
Hello, Catherine, Channel Television. Just wondering about the availability of lateral flow tests, and also just about the point that you reiterated about how important it is for symptomatic people to get tested. So the first, part of the question is, will you be continuing the free lateral tests for people beyond the 2 weeks? At the moment it's just for 2 weeks, and obviously if your guidance to increase, to encourage people to use it twice a week, would you be looking to extend that period for people to be able to obtain them?
So the free lateral flow test, people are being given a box of 25. So that's a considerable period of time. That's about 3 months worth of supplies. So we'd want to carry on for at least that period of time, but possibly beyond that. We'll obviously assess the process as it occurs. So that was the first part of your question. The symptomatic testing, our intention is to keep that through PCR testing at this point in time. But we are doing a lot of evaluation, our own evaluation of lateral flow testing, because obviously we can look at the manufacturer's criteria, really important, but we also need to look at our real-world experience of how they perform in our hands, and so far I've been very impressed by their performance. However, with symptomatic testing, is we want to use a slightly more sensitive test, but also if other viruses come up within the population, if we start seeing flu activity, we then have the ability to not only test for COVID, but consent the person for testing for flu. So you've come to me with respiratory samples, and I'll say, could we test your sample for COVID, respiratory syncytial virus and flu? So it'll give us a better idea of what our risk is with symptomatic people. So it's a slightly different question that we're asking with that. And your second question?
Yeah, that was.
Well, both of them. Okay, right.
Yes.
Talking of lateral flow testing, what has the response and the uptake been like since they were made available on Monday freely to everyone?
I think it's been pretty good, hasn't it?
Yeah, it's been absolutely excellent, and I know that thousands of boxes have been picked up, so really excellent and very positively received by islanders. And we have a sort of group of people that regularly feed back to us, and I think the feeling is that this is a real key part of living responsibly with COVID. What we're saying to people is, here's a tool for you to assess your own risk. And you know, if you're visiting, as I say, your grandmother in a care home, doing a lateral flow before you go in just gives you the reassurance and gives the whole system some reassurance. So I think very positive.
Thank you. Juliet?
As we move to live with COVID, obviously you stopped publishing the figures on a daily basis on social media, although it has still been available on the state's website. We have had some feedback to the newspaper that some people have felt that the rising cases have possibly crept up on them because it's not necessarily as easy to see in your daily life, because not everyone necessarily checks the state's website every day. Have you considered possibly maybe once a week republishing the figures just to give people a bit more of an idea of the direction, or is that not something you're looking at?
Well, I think it's always under consideration, Dr. Brink. I think there is a fact is that we want it to be balanced. We don't want people to be overly concerned that it's up 15 today, it's down 10 tomorrow. Well, I'd be delighted when it's down 10 tomorrow. But we don't want it to be something that's slavishly done, because we're going to have to live with COVID. We're doing we're doing the voluntary things, etc., lateral flow tests and the like, gradually relaxing border restrictions. So we don't want people to get fixated with it. I don't know if there's anything you want to add, Dr. Briggs.
No, I think it's a difficult balance, because people want information, and if we publish it every day, then some people say, well, don't publish it every day, we're tired of seeing it. So it's always trying to find that right balance. So we thought having them on the website and not pushing them out on social media. But again, I'm sure our comms colleagues will advise us on that. Some people have said they'd like us to do a blog every now and again, just here's an update. So it's a question of how people want to receive the information. I think I've been very clear throughout the pandemic that it's our information and that it's there to be shared. And so it's a question of, and any feedback on that from any of your listeners or readers is of great value to us, because we want to present in the right format.
Matthew?
How much will this additional lateral flow testing cost, or do we already have the stock?
We've got the stock for free. We hope it will continue to come for free. But if it comes a time when we need to pay for it, A, we hope that doesn't happen, but B, if it does happen, we will pay for it. The money will be available. So I can't tell you what the cost is. Well, I can, it's zero. But if it becomes X, Y or Z, people will be informed.
How have we got them for free? How has that happened?
Because we've got a good relationship with the National Health. Because that's the true reason. They are, the relationship from the beginning of this pandemic with the National Health has been truly excellent. In my time as chair, which is now over a year or so, the Minister of State, he's now moved on, but he's been replaced by somebody else, because that's the way it works in UK politics. The relationship was absolutely fantastic. It is very good. So, and we hope that's not going to change, and there's no expectation that it will.
We obviously have a lot of talks with parents, and they would like to know, possibly, are there going to be any school measures introduced, obviously if cases get worse?
I'll ask Dr. Brink, but we're always in close liaison with education, sport and culture, well, education part of it really, to make sure that children, teachers, assistants, etc., that the best regime, and it's a fluid and flexible regime, is implemented. Dr. Brink.
So education are going to be looking at the recommendations, as are a lot of other departments as well. So what we're presenting today are some high-level recommendations, but we're not envisaging any significant changes within the school environment, but there might be some tweaks in what we recommend.
Catherine on television. You mentioned just previously about travel and that you're not planning on changing any advice, but obviously we're looking, I believe, one of the busiest weekends probably this year coming up. I mean, do you have concerns?
Dr. Brink.
So I think, as ever, of course, we'd want people to be cautious. Of course, we want people to come forward with symptoms, but we will be putting other measures in place without stepping too far ahead. We'll be looking at some return to school testing and so on. So that will have to be done as part of the general package. But we also want to be cognizant of where our risk is, and absolutely clearly our risk is internal at the moment. And when we look at our sequencing data that we've had, the A142, the Delta lineage that we've sequenced, those were internal infections. They weren't infections in travellers. So we know that we've got A142 internally. So we need to be absolutely clear that we put interventions in the right place and not just because we think it's a nice thing to do. So it's really important that we target those interventions where the evidence suggests they're needed.
The reintroduction of the masks advice, it seems likely that it's likely to have an effect on the hospitality industry, because obviously that is a place where people are indoors in close proximity, and obviously if you're going out for a drink or a meal, you might be slightly discouraged if you've got to obviously wear a mask a lot of the time. Has the States looked at possibly doing financial support to hospitality businesses if they are impacted by these measures? Is this something you investigate?
Let me answer that, because A, I'm a politician, and B, I've got hospitality interests. There's no intent at the moment, and things might change, to give hospitality further support in that regard. The intent is that you wear your masks appropriately. You don't necessarily wear them in the restaurant. That advice may change if circumstances change. But what we will be recommending is that waiters, waitresses, etc., they wear masks when they serve people, that the staff of the restaurants, like the rest of us, are advised to take regular twice a week minimum lateral flow tests, and that possibly there's a record kept that members of staff, because a lot of the members of staff in hospitality live in staff accommodation, that's properly policed and the records are adequate so that they can be supervised. Dr. Reid, do you want to add anything?
No, I think that's...
I've got the answer right, that's good. So, Matthew.
I'm sorry to remain on this subject from the question before, but you say we won't be considering further border restrictions because you're not as concerned about cases coming into the island. However, we are approaching Christmas and the festive period when people will inevitably be travelling to see family backwards and forwards between the islands and the mainland. Yeah. Is this a consideration?
Well, no, the answer is that everything is under review. Everything is under review. If Dr. Brink, for example, said in answer to a question from one of the other journalists, we're not looking at a lockdown, it's a very, very unlikely. If all of a sudden there was a variant that was resistant to vaccines, we'd have to make a decision. We will keep in, and also, it's the John Donne thing. We're not an island on our own. We've got to be cognizant of what happens elsewhere. So I doubt, I'm not going to say for sure, that we'll be making in the next 2 months or so any significant changes in that regard, but it'll be kept under review. Do you want to add anything, Dr. Green?
Yeah, if our travel-associated cases increased, we might consider relooking at border testing. We will always respond to the evidence that we've got in front of us, and we'll put appropriate mitigations in for that evidence, which is why we spend so much time, as every day I produce a daily report and I look at every single case and the attribution of every single case. If it looks like we're shifting to a greater number of travel attribution, of course we'll then go back and have a discussion as to what mitigations we should put in place. So we need to be flexible in our response.
This isn't directly related to COVID, but I've had reports that one of the wards in Princess Elizabeth Hospital has been sort of reworked as care home beds, as currently there is a shortage. Basically, what is the situation there?
Well, I think that's still happening. There is Dr. Brink will know more than me. Dr. Raby will know more than both of us. But that's had to happen because there is a shortage in the island of care beds. So people who would otherwise be in a residential home are having to be occupying beds that otherwise would be available.
Can I also ask, because there's also a shortage of hospital beds, so elective surgeries are continually being postponed. So how is that balanced up between the care and the hospital beds?
We, the politicians, are looking to address that as best we can. But there's no easy or early solution. And you're right, it does mean that people who could go and have an operation or do something else can't go and have their operation because there isn't a hospital bed for them. We're not in impossible circumstances, we're in difficult circumstances. There's, it's a situation that the health authorities and the states, the politicians in general are seeking to resolve.
It sounds like the booster program's been going really well. Are you expecting for it to be expanded to younger people? Younger people going forward. And do you have any sort of timescale for when that might be?
So that's a really good question, as usual, Juliet. With regard to that, there is work going on. So the booster program relates to the duration of immunity. So we know in older people, the immune system can decline with time, particularly in older people. The under 50s, they're having a look at the duration of immunity now. So don't forget, a lot of those people have only relatively recently received their vaccination, so that data is not yet there. So there will be a piece of work, or there is a piece of work ongoing as to what the duration of immunity in under 50s is and whether a boosting program should be offered to them, and in which case, and also, if it's going to be offered, what is the optimal timing? So there are two questions that need to be be answered. A, should a booster program occur? And secondly, if the answer is yes, what's the optimal timing for that? That data is not available. We will follow JCVI advice on that, or any other advice from the UK on that, depending what comes forward. But the actual data to analyse that is not yet there. So that's the first thing. And yes, the booster program for the over 50s is going well. It's difficult for me to give you a precise number of the percentage uptake, because obviously every day, because of the 6 months, the number changes.
Thank you.
Just a question following on the booster program that we've had from a listener. Have the booster jabs been tweaked to deal with these new variants, as we're talking about this new Delta variant? Has there been any change to the boosters because of this?
No, so we're using the same primary vaccine that we used before, and we know that the vaccine efficacy is acceptable with the Delta variant. We know it works well for the Delta variant. As we move forward and new variants appear, then that'll be analysed. But it's the primary vaccination, same one as we use for the primary programme.
Anybody else with a question?
I think it's been a few months since I last asked, so I think I can probably ask again. How is the progression on the sewage monitoring programme going? Is that still something we're looking at? Or?
So we did have a look at that, and sewage monitoring is really interesting. One of the problems is on an island jurisdiction is looking at what is best to use as your trigger. And when we looked at some basic data, is by the time the sewage was going to trigger, we'd have about 200 active cases on the island. So we felt that our investment was better in surveillance programs. As always, we have a responsibility to use whatever resources we have in the most cost-effective way we can and get the most benefit for islanders. And so in the first instance, what we're doing is looking at the surveillance program. As the sewage techniques refine, it might be that we can use them in the future, but at the moment the trigger was just too high, because we thought by the time we got to 200 active cases we'd definitely know that we had a problem. It's for that reason we've decided not to use it at the moment. I haven't discounted it forevermore, but at the moment I think the best focus is on surveillance programs directly to detect the virus in people, so to speak.
Anybody else?
One last one from me, Deputy Fairbrash. In 12 days' time, you're going to be in the Royal Court debating the budget, a small, poorly ventilated room full of people. Will you be wearing a mask, face covering, and will you be recommending to your colleagues in the States that they should also wear a face covering?
Yes and yes. Ultimately, it's a matter for the presiding officer, but certainly I'll be wearing a face mask because of these recommendations, and I would expect all my colleagues to do so too. I mean, when we stand up and speak, we might have to take it off so people can hear what we say, and they can hear the pearls of wisdom from the President of PNR at that particular occasion, but other than that, we'll keep the mask on. Anybody else? Thank you, everybody. Thank you, everybody, very much indeed. Thank the media for what I thought was some persistent, perceptive and stretching questions today, if I may respectfully say so. But thank everybody out there. Help us to help you to help everybody else. Have a good day. Thank you very much.